And that's what we saw here with this video, is that this person's spine wore out over time because their neck was in an abnormal position. And that abnormal position could have been caused by trauma or because of repetitive habits that they have at work. Does that make sense?
Mm-hmm. Very much so.
All right. So if we look at these two necks, so this is a person facing this direction. So their jaw's here and their skull is here. This person has a nice normal neck curve indicated by this black line. Those vertebrae line up right along that black line. The discs are spaced widely. The bones don't have any spurs on them. No degenerative changes there. This person, on the other hand, instead of the neck being on that black line, their vertebrae are lining up along those red lines, which is almost the opposite of what should be normal, right? And then these discs down here are thinning out, and we're starting to see bone spurs occur. So these two patients are about the same age. Yet one looks like they're a lot older if you just looked at their spine. So you have two ages. You have your chronological age, which is, done through the calendar. But you also have your physiological age. So this person is aging quicker than this person right here. Who here wants to age quicker than they need to?
Okay.
Yeah, okay. So I'm glad we're all in agreement. Okay? It's pretty straightforward. When we look at structural problems in the spine, they're going to lead to two basic things. And I'm going to go over the second one here. The first one we just talked about. If you have abnormal alignment in the spine, it's going to increase wear and tear in your spine, and your body is going to wear out sooner than what it should. Okay? Nobody wants that. Osteoarthritis and degenerative disc disease. The second thing is that if your spine is out of alignment, it is putting stress on the nervous system. The nervous system does not work very well when it's stressed. Okay? And certain studies have even shown the weight of a dime on a nerve root can start to decrease how well that nerve works. So it doesn't even take that much pressure sometimes. And especially if that pressure is sustained and over long periods of time. So it's kind of like, if I've got this nerve here, we'll use in the lower back again, that sends strength and energy to my leg, and it supplies the organs in this region, and it supplies my back muscles. If that nerve isn't working at 100%, but maybe it's only at about 76%, is that okay? Yeah, it's not okay by me either, right? So if we can find a way to try to take stress off those nerves, then your body can function much better. Does that make sense?
Yes.
So a neurosurgeon from Sweden by the name of Alf Breg back in the 60s, we love Alf Breg because you know what he brought to chiropractic is he showed us kind of why alignment is so important to those nerves. And what he did is he did a study where he removed the back of the vertebrae here in the neck. It's called a laminectomy. And he removed the back of these vertebrae so he could see what's going on with the spinal cord. Pretty disgusting, right?
Yeah, it is.
But he's a scientist, and he's trying to answer certain questions because he wanted to know, if I have a normal arc in my neck, why is that good for my spinal cord? And then if I have an abnormal curve in my neck, like this guy here, where the curve is flat or going the wrong direction, or my head's too far forward, what does that do to the spinal cord? And here's what it does. And this is an artist's rendering of the photographs he took because the photos are a little bit too disgusting. So we just went with the illustration. But here's the spinal cord. You're looking at half of it. And these are the nerve roots that come out the sides. You follow? So we've removed the bone. We're looking at the spinal cord. This is what we would call a good neck curve, right? Where the neck is in the normal position. It has a forward arc to it. And you look at the spinal cord nerve roots, there's a lot of slack in there. Okay? And there's a lot of blood in the vessels. And here, the neck is in a flattened and forward position. So we really stress that neck in the wrong direction. Look at what happens to those nerve roots in there. Does that look tighter and more taut?
Yeah.
Yeah. And then look at the blood vessels. They actually have less blood supply. The little neurons, the nerve cells, are actually going hypoxic. They're losing oxygen, right? So the really lame part about that is that your neck is literally a bottleneck to get information to the rest of the body, right? So when I start screwing with systems here, it can have an effect all downstream, so to speak. Right? Remember Christopher Reeve? Superman broke his neck right here. What happened to the function of everything below?
Yeah, gone.
Shut right off.
Yeah.
Okay? Couldn't even breathe on his own. Had to go on a respirator,
Yeah.
right? So this area is vitally important. And when you lose the neck curvature, what you're doing is you're putting stress on that spinal cord way up high there. And obviously that's not going to be too good for you. Great. So, cheery news. What do we do about it? Well, first of all, we try to figure out what is causing that problem in the first place, right? It can start day one. You know, we can have a birth trauma that occurs. You know, we check kids out, make sure that they're doing okay if parents are concerned about kids having problems. You know, we see colicky babies and stuff like that to see if there's something chiropractic can do to help. Because the nice thing about chiropractic is we're not using drugs or surgery.
Right.
The risk factors are very minimal, right? And usually I can tell if we can help a kid, and we just do some simple procedures and off you go. If it doesn't work, then you take the next step. You take the medications or whatever, right? Car accidents, you ever been in a car accident?
No.
No? Good. Don't do those. They cause damage to your spine. Have you ever fallen?
Yes.
Okay, that can create damage. How about sports injuries?
Yes.
Okay, so all these you can't really control, right? Stuff happens, right? But chronic poor posture is the one that you can control. And that's where we want to focus our efforts, right? Just like genetics. I can't control genetics, so, you know, let's not worry about it. Let's do what we can. So you sit in the car, right? You commute, and that can create postural problems. You get to work, and you're engrossed in your work, and you're sitting there hunching over like Quasimodo, right? And then you get home, and you're surfing the internet, hanging out, right? So it turns out 90% of my day, I've got my head going forward. That's why it's the most common problem we see, right? And it wreaks havoc. It creates headaches, neck pain, radiating symptoms in the arms, upper back pain, that sort of stuff. Okay? So, you have to figure out where your issues are coming from and then try to do something about correcting those if possible. A couple of studies here that I just throw in for people with kids that a medical doctor, of all people, again, not chiropractic, right? Medical doctor studied 1,000 infants and discovered that trauma to the upper neck caused many health problems beginning in childhood due to their lowered resistance to disease. Their body was not working very well because they had issues here, basically, for lack of a better term, pinching nerves off, right? By realigning the neck, sounds a lot like chiropractic, they were able to eliminate these conditions of lowered resistance. The kids became healthier. Pretty well, huh?
That's pretty interesting.
This is a study done out of the Harvard Medical School that had a correlation between problems in the spine and SIDS with young babies as well. So pretty interesting study there as well.